In this video, we will be reviewing manual muscle testing for hip extension as well as isolating the gluteus max. The following are the muscles. Gluteus maximus originates on the posterior sacrum and ilium and inserts on the posterior femur and IT band and is innervated by the inferior gluteal nerve. The next muscle is the semitendinosus, which originates on the ischial tuberosity, inserts on the anterior medial tibia, and is innervated by the sciatic nerve. Next is the semimembranosus, which again originates on the ischial tuberosity, but inserts on the posterior medial condyle of the tibia, and is also innervated by the sciatic nerve. The last muscle that controls hip extension is the long head of the biceps femoris. It originates on the ischial tuberosity, inserts on the fibular head, and is innervated by the sciatic nerve.
Alright, in this video we're going to be doing manual muscle testing for hip extension. So for hip extension for grades 3, 4, and 5, our patient is going to be in prone on their stomach. And what we're going to ask them to do is to have them bring their leg up to the ceiling. So go ahead and try that now. Alright, and relax. So grades 4 and 5, what we're going to do is we're going to provide resistance just above the ankle, and we're also going to stabilize at the pelvis, and we're going to be on the same side as the leg that we're testing. A grade 4, we're going to do moderate resistance, and grade 5 is maximal resistance. So we'll ask our patient to come up to that full range again. Bring your leg up and hold it. Don't let me move you. Hold, 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 relax. Okay? So those are grades 3, 4, and 5.
Okay, for manual muscle testing 2 and 1 and 0. For hip extension, your patient is side lying. So we're going to take the bottom leg and bend it to 90 degrees just for support. I'm going to hold the leg and support the leg right here, and I have my hand on her hip, and I'm going to ask the patient to, can you move your leg back towards me and back to the front? That would be a 2. Now for a 1, patient is prone on your stomach. Okay, so we're just palpating. You want to make sure it's okay with your patient. Can I palpate?
Yep.
Thank you. So you want to right at the ischial tuberosity, so it would be at the crease of the glute. So right here, you would press and have the person attempt to raise their leg. And you're palpating for the hamstrings in that position. And also you go to the middle of the glute, you press deeply and have them go up for a 1. And if there was no muscle contraction, that is a 0. Good.
Alright, the next manual muscle test that we're going to do is, again, hip extension, but in this we're going to be isolating the gluteus maximus. So to do that, we're again having our patient in prone, but we're going to bend the knee. That way there we're eliminating the effect of the hamstrings on hip extension. So what we're going to do is, again, ask our patient to bring their leg up to the ceiling and try to hold it there. Alright, and relax. That would be a grade 3. For grade 4 and 5, we're going to be stabilizing at the pelvis and providing resistance just above the knee. And the grade 4 would be moderate resistance, and the grade 5 would be maximal resistance. So go ahead and lift your leg up. Hold it there. Don't let me move you. Hold, 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 relax. Okay, so those are grades 3, 4, and 5.
Okay, for grades 2, 1, and 0 for isolating the glute, the therapist is positioned in front of the patient. Okay, can you slide closer? You want to have the knee flexed and cradle the leg. You can support at the hip, and have her, can you move your leg backwards? Good. That would be a 2. Okay, for grade of 1, what we're going to do is you palpate in the glute region. So it's okay, I'm going to palpate the muscle right now. It's okay with you? Okay, great. So right here, you're going to have the person ask them, can they basically squeeze their cheeks together while you're palpating right at the glute. So can you squeeze? And that would be a 1. If there was no contraction, that would be a 0.